Hello friends, today I am going to explain you here about shock indices. Why this is important to identify the shock. This is a life saving. If you know about shock indices, that means you are able to shock someone's life. So early identification of shock can usually affect the prognosis of patient, which I explain is life saving. Relying on single parameters such as pulse rate and blood pressure BP. Capillary refill, peripheral temperature, and urine output are either unreliable or late indicators. These are the late indicator, but pulse rate and BP shock index is very important. Shock index is considered as heart rate divided by systolic blood pressure. Shock index is an early indicator of shock with good correlation between the grade of shock, blood transfusion requirement, hospital stay, ICU admission, and prognosis. Early detection is always helpful. Additionally, since it is easy to calculate, it can be used as beside indicator. MSI is a modified shock index. Nowadays, this is more useful. So, heart rate divided by mean atrial pressure. How to calculate mean atrial pressure? In some digital monitors, mean atrial pressure is always seen. But if you want to calculate on the basis of systolic or diastolic, there is a formula. Mean atrial pressure, how to calculate? Systolic blood pressure divided by 3 plus 2 into diastolic blood pressure divided by 3. Okay, so this is the best formula. You can calculate mean atrial pressure. Okay, now what is normal grade of shock index? If shock index is 0.5 to 0.7, consider as normal. If less than 6, there is no shock, absolutely no shock. If 0.6 to 1, consider as mild shock. If 1 to 1.4, moderate shock. If more than 1.4, consider as severe shock. Systolic blood pressure falls only after 30 or 40% blood volume loss, class 4 hemorrhagic shock. Whereas diastolic blood pressure changes as early as in class 2nd hemorrhage and hence was proposed to be better indicator for early diagnosis of shock. In modification of shock index, the denominator systolic blood pressure was replaced by MAP. Okay, so if this is replaced by MAP, mean atrial pressure, that means considered as modified shock index. Larger studies comparing shock index and modified shock index are awaited, though smaller studies comparing them show greater sensitivity of modified shock index when compared to shock index. Okay, so modified shock index is much superior. Some other is respiratory adjusted shock index, RASI. Heart rate divided by systolic blood pressure into respiratory rate divided by 10. Change in the respiratory rate also occurs early in shock, and hence on inclusion of respiratory parameters can increase the sensitivity of index of diagnosis of early shock or occult shock. Studies comparing RASI with serum lactate levels show good degree of correlation. Large scale validation is still awaited. So 3 indexes we study here: shock index, systolic blood pressure divided by heart rate, and modified shock index is systolic blood pressure divided by mean atrial pressure. Okay, so hope it's clear. And one more is respiratory adjusted shock index, where heart rate divided by systolic blood pressure into respiratory rate divided by 10. So guys, these are the parameters you identify shock as early as possible. So hope this video is clear, and if you want more such videos on trauma surgery series, then write in comment section and don't forget to put like on this video. Thank you. I hope your concepts are clear.